Здравствуйте, уважаемые участники. Выбирайте канал, на котором вы будете слушать.
So hello, dear participants, and please choose your
recording in
language
progress.
channel.
English or Russian. Тань, эфир.
Так, добрый день, дорогие коллеги.
Good morning, dear colleagues. I am Tatiana Deshko, and I'm happy to welcome you at this online presentation of the e-course adapted for EECA region online drug decriminalization e-course. We will work for about 1 hour. We will have intensive discussion involving those who developed the course, who funded, and the work who have already tried the training course, and maybe who have already worked on the documents and on the results. During the discussion, you can ask questions immediately in the chat box. And during the last 20 minutes, we will try to address your online questions and comments in social media. Public Health Alliance for Public Health within with the support of the public of the Global Fund focuses a lot on the decriminalization of drug use, because obviously the prison is a bad doctor. Unfortunately, this is the source of infections that may undermine not only health, but also lives of people. So people are released with TB, HIV, hepatitis, and then the healthcare system needs to work on those issues to resolve them. In our region, Eastern Europe and Central Asia, actually imprisonment remains the key method and a very inefficient method to overcome the problem of drug addiction. 3 out of 4 people using drugs in Belarus have ever been in prison during their lifetime. 3, and this is almost 50% of people in Kazakhstan and Kyrgyzstan. They have also had the experience of being in prison. The prison is not only a bad doctor, but also a very expensive intervention. Keeping just one inmate in prison is 5,000 euros annually. It is in Belarus and Kazakhstan, 1,200 euros in Kyrgyzstan, and this is huge amount of funds that taxpayers have to pay in order to actually not treat people, not provide care for people, but just to make them even more disintegrated, unintegrated in the society. So now I would like to share a couple of slides. These are results of our survey. The survey that was actually held by an Economist intelligence unit in 2020. So they analyzed what could be done to the resources to use them more efficiently, to reduce the degree of criminalization of drug use. The suggestion was to criminalize, to decriminalize only individual use. This is about low doses for which it would be possible to avoid imprisonment of people. So if you stick and to decriminalization in the respective 4 countries and reduce the number of inmate drug users by 25 to 46%, it would be possible to save a sufficient amount of money, a significant amount of money. For Belarus, it is 431 million euros, Kazakhstan 773, Kyrgyzstan 38 million. So this is huge, and this could be used more efficiently. And actually, the suggestion on how to redistribute these funds to invest them into the treatment programs for users of drugs, for example, to expand the scale of ART as recommended by UNAIDS to ensure the cascade, or coverage with OST of 40% of people using drugs. So that would be sufficient amount of funds in order to fully implement the objectives for HIV treatment to ensure coverage with OST, and there would be even more money left to use for other social integration and care programs for to provide other kinds of services for injection drug users. So thank you so much for showing this slide. So often when we speak about decriminalization, it becomes a synonym of kind of popularization, promotion of drugs. Sort of that when we speak about decriminalization, we stop fighting trafficking of drugs, but that's wrong. And in the framework of this training course, we try to highlight these aspects of decriminalization to have a better understanding of what kind of policies, objectives are implied, and how decriminalization of individual use could be implemented in practice. And it is very relevant to mention it today because just recently British Columbia recognized the epidemics of drug addiction and overdose, and the main response activity mentioned is decriminalization of drug use. This is actually the key response mechanism for this kind of epidemics. Well, now I believe I will stop here, and now I'm ready to proceed with our next speakers. I would like to invite Alexandrina Yavita from the Global Fund to say a couple of introductory words. She works in CRG team, rights and gender community. So Alexandrina, why the community of rights and gender, why decriminalization are so high on the agenda of the Global Fund, which actually deals with healthcare aspects? So the floor is yours.
Thank you so much. Just to mix it up, since we're talking about the fact that language is no longer a barrier, I'll actually speak in English. Thank you so much for this great initiative. Making sure that this great course by IDPC is available to a broad range of activists from our region, Eastern Europe and Central Asia, is absolutely imperative. It's a great resource, but it's going to equip us all to be able to work together for a great aim. We all know that criminalization wreaks havoc, and it interferes with our ability to achieve good public health outcomes. It interferes with our ability to uphold human rights. We all know that there is commitment to ensure that there are good public health outcomes and that human rights are part and parcel of everything we do to be able to end AIDS. There are global societal enabler targets for the first time ever, and the latest HIV political declaration that was adopted by member states has a specific focus on ensuring that there is an enabling legal environment and that countries end those legal and policy barriers to effective public health responses. Our own Global Fund new strategy has a strong emphasis on working on decriminalization, on ensuring that we give the tools and the prominence to the activists that are doing that kind of work at country level. Why is that? Because we have heard you. During all the partnership forums that have informed the Global Fund strategy development, we have heard how important it is for us to ensure that we don't separate the efforts from service provision to advocacy, but we make sure that we work together to achieve those common aims, and we're able to equip the activists with the knowledge that they need, with the tools that they need to have the most effective advocacy. which is why such a course from IDPC translated into Russian and accessible to the broader group of activists in Eastern Europe and Central Asia is so useful. On our side, the Global Fund continues to have a strong commitment to funding comprehensive human rights programs to ensure that we don't just advocate to remove criminalization laws, we don't just decriminalize laws, but we also support efforts that lead to more protective law enforcement. We work with law enforcement to understand the duty to protect key populations. We work with a justice system, with judges, so that they know how to apply the laws. We encourage us all to use this course to be able to have clear advocacy strategies in mind. We encourage us all to use this course to be able to equip us with all the tools that we need for such a comprehensive response, to be able to identify what are the right entry points to work on decriminalization, to be able to set clear and measurable milestones of the process that will take us eventually to decriminalization, and to be able to complete that work, not just stopping at the law reform stage, but making sure that the laws that are reformed get enforced, get implemented, and lead us to have a rights-based and strong and sound public health approach. So congratulations again. I hope that we'll hear about a lot of great activists in our region benefiting from this course. And I'm really counting on having a movement that will work together towards decriminalization of drug use, a movement that will work together towards ensuring that we are able to move a needle and end AIDS in our region. Thank you.
Спасибо большое, Александрина.
Thank you, Alexandrina. And now we are going to talk more about the training course. So the training course is now available in English. It was developed in English, then it was translated and adapted for French speakers, and now it has been adapted and translated into Russian. And now you will see a short promo video to find out more, to have a better idea about what kind of a training course that is. We believe that drug use should not be seen as a crime, and that people who use drugs must not be subject to punishment. The process that makes it possible to achieve that is decriminalization process, and it may be the key to protect human rights and to ensure public health. However, sometimes it's difficult to defend and implement decriminalization. It may be required to change the public opinion, political messages, the national legislation, as well as methods of work of police and courts. Course for drug decriminalization is free, open, online training course for everyone who's interested. It includes 7 interactive, interesting, engaging modules that will introduce the definition of decriminalization and those who already support this approach, the current models of decriminalization in more than 30 countries globally, how to better substantiate the need for decriminalization, arguments, evidence-based, various policies and frameworks for decision-making for practical implementation, how legal system can discern drug trafficking and individual use, other types of responses in addition to decriminalization, voluntary treatment, and harm reduction. What's the golden standard of decriminalization? You can undertake just one module or all the 7 of them in any order that you choose. The course has been developed so in order to meet your needs. At the end of each module, you receive your participation certificate. Marina Zhia, the host of our training course, will introduce the modules, and they will take 1 to 2 hours for you to complete. They include videos, practical exercise, and the key information that will prepare you to promote the world towards decriminalization, further away from war on drugs. So decriminalization training course was developed by the International Drug Policy Consortium in partnership with Mainline, Healthy Foundation, Frontline AIDS, with the financial support of Pitch and Robert Carr Foundation. Translated into Russian with the financial support of the Global Fund, Alliance for Public Health, SOS Project 2.0.
Спасибо большое. Итак,
Thank you very much. So that is the modern approach to training, and we have an online course which is free, which contains 7 modules, and people can take modules in any order, and people can get a certificate of completion or participation. So that is a great modern approach to education, and it is aimed to give people practical understanding of the situation and practical tools on decriminalization, the approach and its implementation. And our next speaker today is Marie Nougier from IDPC. This consortium was actually the initiator of this course, and now it is one of the key organizations which supports the development of this course. So Marie, please tell us how you got the idea of this course and how successful it is now, because Alexandrina asked us this question, so how we can actually implement it in practice. So what results of the course can you present us for today? Thank you. Over to you.
Thank you so much. Hello, everyone. Hi, hi, and thank you so much for joining us today for the launch of the Decriminalization e-course in Russian. My name is Marie Nougier. I'm the head of research and communications at IDPC, and IDPC is a global network of NGOs that come together to promote drug policies which are grounded in social justice and human rights. And I'm really excited to be here today to present the Decriminalization e-course. So the course was developed by IDPC, but in very strong partnership with a few organizations, which are Mainline, the Health E-Foundation, and Frontline AIDS. And as the video says, we got funding from the Robert Carr Fund and Pitch, and the Russian version of the course has been made available thanks to the support of the global funds, the Alliance of Public Health, and SOS 2.0. And I really want to thank them all today to make this possible. So before I present the course itself, I just wanted to explain very briefly why we actually decided to develop this course in the first place. So the primary reason, and Tatiana already said that for the region, but I think it's something that is global, it's because drug policies in most parts of the world continue to be focusing on repression, on criminalization, and on stigmatization. And we all know the devastating impacts that a punitive approach to drug control can have on people who use drugs and on other communities who are affected by the war on drugs. So these include mass incarceration, police violence, extrajudicial killings, arbitrary arrests and detention, many forms of discrimination, lack of access to essential services for people who use drugs, including life-saving harm reduction services, and this is just to name a few. And so the decriminalization of drug use and related activities is absolutely essential to creating an enabling environment for people who use drugs to be able to access services that they may need to prevent HIV, hepatitis C, tuberculosis, and overdose deaths. And it's also critical to end police violence, prison overcrowding, and other human rights violations of people who use drugs. So today, 62 jurisdictions in 35 countries have adopted some form of decriminalization of drug use, possession, and/or other related activities. But what we have seen is that there are major differences in terms of what these decriminalization models look like and what their real impacts have been on the lives, on the health, and on the rights of people who use drugs. And so we've been receiving increasing numbers of requests from IDPC's membership, but also from policymakers in many parts of the world who were requesting tools and materials that would help to better understand what decriminalization actually is, how it has been applied so far, how well it has worked, how much better it could work, and what would be the gold standard of decriminalization. And of course, for civil society, one of the key topics of interest that came over and over again was how can we advocate in favor of decriminalization? What decriminalization model would work best in our specific context? And how can we bring about change, including in particularly repressive political environments? And in the meantime, the COVID-19 pandemic started unfolding, and with restrictions of travel and face-to-face meetings and workshops. And so this is in this context that we started developing an e-course about this topic. So the objective of the Decriminalization e-course is to provide a free, open access, low threshold, and flexible course for drug policy reform advocates primarily, but also for policymakers if they wish to learn more about some aspects of decriminalization. So the video described it quite well already. So the course includes 7 modules. It's still under development. So for now, online, you have access to the first 5 modules in English, the first 4 modules in French, and the first 3 modules in Russian. The idea is to have the final 7 modules in English, Russian, French, and also Arabic. And so it's really exciting to have at least the first 3 modules in Russian language today, and we'll send you updates once the next modules are available online. So the end goal is really to strengthen the capacity of NGOs on the ground to better advocate for decriminalization in various political contexts. So it can be used in contexts where drug laws and policies are very repressive and where the conversation about decriminalization remains nascent. It can also be used, though, in contexts where decriminalization is already on the decision-making table to help support the discussions with very practical and technical advice drawn from the current models and experiences of decriminalization and best practices on how to best protect and promote health and human rights for people who use drugs. And finally, it can also be used in contexts where decriminalization is already in place, but where there's clearly a need to improve the current model to reach the gold standard of decriminalization that is proposed in this course. So Russia, for example, is one of the 35 countries that have technically decriminalized drug use and possession, but clearly the approach is not working. So the course helps to elaborate on what are the aspects that could potentially need to change to make sure that the system works better. So you'll have seen from the video that each course focuses on a specific aspect of decriminalization. And depending on your level of knowledge of decriminalization, you can basically choose to undertake one or several or all of the modules, and in whichever order you prefer, and you can go back to them if you'd like to. So each module really is conceived as an independent one that you can take and pick and choose whenever you'd like. So module 1 provides an introduction and definitions and elaborates on the current support for decriminalization, both at national level and also at global level, including at the United Nations. The second module provides information about some existing models of decriminalization and some of the strengths and weaknesses of these models. So there we focus primarily on the examples of Portugal, Czechia, and Uruguay. In module 3, we start talking quite a lot about how to make the case for decriminalization, how to advocate for decriminalization. And there we provide some examples of advocacy efforts in countries primarily in Norway, in Ghana, and in Malaysia. And we also provide a bit of information on how to plan advocacy. Then in module 4, we go into the technical details of how to design a decriminalization model, and in particular, how to decide whether to advocate for a de jure or a de facto model. So meaning whether you want to advocate for change in the law or change in practice or a mix of both. And who makes the decision as to whether drug possession is for personal use. And there we use the specific examples of South Africa and the Netherlands. In module 5, we focus on the very technical issue of quantity thresholds and how to determine whether drug possession is for personal use. And there we use the examples of Eastern Europe and Central Asia, Spain, and Colombia. In module 6, we focus on the sanctions and responses. So when you remove criminal sanctions, then what is the response when people are caught for drug use? And there we really promote a model that focuses on avoiding any sort of sanction, which is no administrative sanctions, no criminal sanctions, and promotion instead of voluntary referrals to health, social, and harm reduction services for those who may want and need them. And there we focus primarily on case studies from Switzerland, Kyrgyzstan, and the Philippines. And finally, module 7 focuses on the gold standard of decriminalization. So it basically brings everything together and draws the conclusions for the entire course. So I'm actually the official host for the course. So each of the modules starts and ends with a short video from me introducing the key aspects of the module, and then concluding with a very short summary of the key points for the course. Then each module includes a mix of written text and case studies. We also have some points to ponder on specific issues, some short videos, and many interactive exercises. So we really want to make sure that the course is as accessible and dynamic and interactive as possible. But obviously, you know, if you have any feedback on how to improve it, please do let us know. At the end of each module, you actually have the opportunity to fill in a brief feedback form to let us know how you found the course and if there is anything that you think we've missed or that's unclear. So this is super important because we really want to ensure that the course is as useful as possible for those who take it. So we really take all of this advice to heart. And so far, more than 470 participants from over 80 countries have gone through the course, which is super exciting. We also hope that we'll have now more, now that the Russian version of the course is available, and obviously the Arabic version is also coming in the next 2 to 3 weeks. So I just wanted to finish here with a few quotes from people who have actually gone through the course. Obviously, we'll have Yorena later today who will share a bit her impression of the e-course and whether it's been helpful for her work. But I just wanted to put a few out there. So the first quote says, "The course is wonderful, congratulations, a great resource for all. I will be sharing this with loads of people, easy to access, interesting and interactive, and powerful information, well done." The second quote, "Good mix of content with something for everyone, whether beginners or experienced in this field." Third quote, "It was really great learning experience, which will definitely help me to further understand the modalities of decriminalization. Looking forward to the next module. Great balance of videos, written content, and exercises to improve retention." And the last quote, "I think it can be an important tool to get people to be better acquainted with decriminalization and also for activists advocating for change in drug policy." So that's it from me. I thank you so much for your attention. So my contact is here if you'd like to get in touch. And this is the link for the course, but I'll also put it in the chat for all of you. So thank you again, and I hope you enjoy the course.
Спасибо большое, Мари. Потрясающая инициатива, прекрасный курс.
Thank you so much. This is an outstanding initiative and a great e-course. And it's obvious that it is practitioners who have many years of experience working on drug policy who have developed that training course. And that is why these important aspects, de jure, de facto decriminalization, or the threshold amounts of substances, these are all so relevant, so important themes. So thank you so much for sharing that. And now, if you have any questions, you are welcome to ask them in the chat. And also, after our speakers, we will have a Q&A session. And now I would like to pass the floor to Hanna Dovbach from European Association EHRA. Anna and the association helped to adapt this training course for EECA region. So the training course was not just translated into Russian, but also adapted. So Anna, what was it important to take into account for the region? What were the highlights and how is it supposed to work in our region? Thank you so much, colleagues. And I'm happy that we already have this course available in Russian. Together with IDPC, we help them to do a couple of videos that will actually highlight this challenging situation in the countries where they declare what's in, but they implement is very different. And for our countries, for our region, this is what we observe very often, that very frequently in constitution it sounds nice, but it doesn't work in practice. So let me emphasize that for us, this training course and the focus on decriminalization in the region, that's revolutionary, disruptive, because for many years we've been speaking about decriminalization, about the drug policy reform as part of HIV response. And now finally, even more specialists who previously delineated these things, like we deal with health while police need to do with those arrests. But now it is time has come where we understand that decriminalization incurs a lot of costs, and we pay the price of lives, we pay huge investments that result in actually even more costs from the state budget. And this pragmatic approach to the drug policy to avoid propaganda, this is so important for us. And that is why the e-course is not just for activists from the community of users of drugs, for them to know the terminology. It's not only about better understanding what's happening in the country a bit deeper, but what's also important, that the e-course is also intended for a wider range of people who are interested in policies, in health, in the terminology and understanding of decrim, not to sound as propagandists, to have the arguments. Recently in Lithuania, we saw the situation where European Lithuanian politicians, they tried to substitute, to replace decriminalization with legalization or with some chaotic decision. So, I mean, a lot of parties or people, individuals must undergo this course, training course, in order to be more professional using this terminology. And we are happy that IDPC consortium, and we are actively participating in it, as well as our partners. We are so happy that this course is now available in Russian. I would also like to mention that it won't be sufficient to have just one course to revise, to change the policy. But for us, this pragmatic approach to the drug policy is the theme in order to break, to get rid of certain myths and to make our goals clear. And our podcast, Narco Pragmatics, which is also available, that's also something, a resource helpful for those who undergo the e-course. So thank you, Alliance, for supporting the translation into Russian. We were engaged into that work, testing it in Russian, and we recorded the videos where you will see the members of our team. Thank you. I am reading comments in the chat, and everybody says that it was so easy and interesting to undergo the e-course, great format, everyone. So hopefully this enthusiasm will be spread further. One of the participants who has already completed the course in English is Irena Molnar from Serbia. This is a regeneration organization. So let's ask Irena about her experience of undergoing the e-course. Maybe something that you need to take into account before you embark on the course, maybe some tips that Irena could share, and which of the knowledge you have already applied in practice. So Irena, the floor is yours. We are looking forward to your sharing.
Hi. Hello, hi from Serbia, and thank you for invitation, Jana. I'm really happy to be here and to share my experiences. So I'm a person who is executive director in a small community-based, community-led NGO in Serbia, but we, for 10 years now, really closely working with the government and different stakeholders and also decision makers, but the decriminalization was never at the table to discuss, because our drug policies in Serbia are as repressive as possible, even though criminalization of drug use, drug use is not criminalized in our country, but drug possession is. And the repressive laws that we have in Serbia are affecting the the public health responses that we actually do not have in relation to drug use. And for those terms, this course was very, very useful for us. I would say that I have, during COVID, I passed through 6 or 7 online courses that I have been through Eurasian Harm Reduction Organization, or more complicated as Hopkins University that I did for 6 months. And I can say that this particular course is super user friendly, and the platform is super, super nice to be going through. But one of the advices that I would have as somebody who was going through it is that have your teams, have more members of your teams going through the course, because working through the practice examples and designing the map of stakeholders, or designing different advocacy actions that you're going to do, you need your team to actually brainstorm with them, because going alone through the course is fine and okay. In a inquiring knowledge form is really useful, because I think it shares really good perspective and variety of examples of what different countries and different regions did. But for you to operationally use the information from the course, I think it's needed for 2 or 3 people from your organization or the team to go through it and then do practices together, because only then I think you can design the position of your organization and go out there to discuss it further on with different stakeholders in your country and different policymakers. For us for me, I did it first, and I did it alone, and then I communicated that to my team, and now several other people are going to take the course as well, because I cannot myself do advocacy and discussion with stakeholders, and I wish my team also have this amount of knowledge that we can actually sit down and design it together. I also wanted to say that I was advising this course to newer member of Office for Combating Drugs of the government of Serbia, because they have a new team, and most of the people who are working on, for example, next drug strategy, or can influence reshaping the laws in Serbia, do not really know this broad perspective of what decriminalization can actually be. And it doesn't really mean just one thing, it means different things in different contexts. So I was also advising our stakeholders and our government members, at least the younger ones, to take the course and actually gain some knowledge, so we can actually discuss on different models of decriminalization that we can actually implement in Serbia in order to have better public health response in relations to drug use, and not only repressive politics. So if anyone has any questions, I'm here to answer them. Thank you.
Спасибо большое. Очень важное.
Thank you so much. That's very important comment about the various formats of undergoing the training course, because that's true that it may contribute to your individual understanding and vision of the situation, or if you want to implement practical change, that must involve team effort, teamwork. So thank you for this life hack, and about how it would be possible to work on the training course. And this is the advantage of free online training. So colleagues, this is about our official presentation part. And now you can share your questions, comments. Please raise your hands or write in the chat box, whatever is convenient for you. I'm also checking the hands, so please think about your comments. Meanwhile, I have a question to Marie, who knows the e-course best and as an organizer. So whether the training course turned out popular, how many people have undergone the e-course, and if we can already speak about some concrete outputs, results of implementing these decriminalization approaches that you are promoting.
Thank you, Tatiana. So far we have 470 participants from over 80 countries, from pretty much all over the world. So it's really exciting, it's really great, and we hope that with more languages there'll be more people who will be able to undertake the course, because of course it's, you know, it's technical work, so it can be difficult if it's only in English. That's why we're really making a point of ensuring that it can be translated, but also when we do the translations, we make sure that they are reviewed by people on the ground in terms of terminology and acceptability of the course. So thanks so much to EHRA, for example, who have been able to review the course, translation in Russian. So that's been very helpful for us. In terms of the feedback we've received so far, it's been really positive. The participants have found it quite useful, which is great. We have also received some useful feedback in terms of people saying that, you know, we were focusing too much on Europe and Latin America, that it was really important for them to also hear about advocacy efforts in Africa and Asia. So that's something that we have incorporated in the modules that we were still developing. And that's why the feedback we receive from you all is really important in terms of improving the course and making sure that it's adapted to your needs. In terms of the impacts, I mean, obviously it's one course among many other activities and campaigns and efforts from people on the ground. So I don't want to attribute ourselves like, you know, this is what's happening in Lithuania and that's thanks to the course. But obviously we really hope that it's an additional tool that will be able to support the advocacy of people on the ground. You know, we also have the Support on Punish campaign that is going to kick off in June. So that's also something that, you know, IDPC is helping to coordinate, but that, you know, there's many different aspects of decriminalization advocacy efforts that are out there. We just hope that this course can collate a lot of what's already out there in terms of knowledge and experience, and that it can help people on the ground to continue their amazing efforts to fight against the war on drugs.
Thank you, Marie, so much. And it is really very valuable that the organization that has initiated the course, IDPC, that you are actively working on drug policy. And of course, it's not just about one e-course. And Alliance for Public Health, it is one of members of the consortium. And for us, it is very valuable, this cooperation, because it is an opportunity for us to share the best ideas, best practices in the field of drug policy. And if somebody is not yet part of the consortium, and I really recommend it, is a great platform. So now I see several hands. Olga Bilaeva, you are welcome.
Thank you and good afternoon. So I give the floor to Sergey Bessonov and then I will say, okay, then over to Sergey. Hello, I'm Sergey Bessonov, Kyrgyzstan Harm Reduction Network. So you have probably covered partly my question, responded to it, because I wanted to ask if you think that in all those actions aimed at decriminalization, so IDPC will be actively involved in those actions as well, because we have held some events, some activities, and we see that we need support of some organizations with strong reputations, because in autumn we had the first meeting, but we are not acting so far because all those arguments, they are very important. We were also collecting kind of justification for and evidence for ourselves, and we tried to use it in our country. But in addition to us, we need other people people with a strong reputation who could confirm what we are saying from a stronger position, because I see in the news that the drug services, they ask a director of our local Soros fund for interrogation. So our special services, they now have this law approved that to make like to hear the conversations of people, to overhear it, and for interrogations they do not need to get a permission of a court. So probably the things that we see, they are more aimed at even worse, criminalization of drugs. So really we need here to show this evidence so that decision makers would change their mind. So my question, so if IDPC is going to be involved in activities in countries. Thank you, Sergey. So maybe before I give the floor to Maria for her response, I want to say that really here it is important to have a coalition and to have cooperation of civil society in the country with, and also support of the regional partners. And it is good that we have this partnership for this. We have NPUT, Harm Reduction Association, and we have also in Eastern Europe and Central Asia a regional commission on drug policy. So INA has shared, or will share the email of Elena Kacharuk, secretary of the Regional Drug Policy Commission, because it will be working on drug policies in the countries of the region. So what they try to do is to promote their priorities in our region. So yes, not always we can do it very fast, but we need to do it step by step. And so yesterday the Commission actually had a meeting to reconfirm their commitment and their actions. And the war of Russia in Ukraine, it slowed down many processes in terms of the necessary reforms, but also it is one of the fronts where we need to continue our efforts, because it is also about health and life of millions of people in our region. So Marie, would you like to add anything from your perspective? So the question is probably like broader about the work of IDBC in the area of decriminalization of drugs.
Yeah, thank you so much, Sergey, for the question, and Tatiana for all the information about Eastern Europe. I mean, I think, you know, IDPC was initially created because we realized that we would be able to maximize our efforts if we worked together. So that's basically the premise of IDPC. And so we're really happy to support you in any way. If you think there is a need, that's something that we've done in other countries, other regions. For example, when Uruguay passed their law on legal regulation, they wanted support, like colleagues on the ground wanted support from IDPC via open letters or meetings and stuff like that. So it's definitely something that we can talk about. So feel free to get in touch. Something else that we can do is also quite a lot of our members are in touch with policymakers who have gone through decriminalization themselves. And so if there is any way we can create links between policymakers, that's also something that we can help with. So Sergey, I'll put my contact details in the chat. Just get in touch and we can talk about how we could support you.
Thank you, Marie. And now over to Olga. Input. Thank you. Good afternoon. Glory to Ukraine. So I have two things I wanted to discuss. The first one, all our focus in drug policy since 2004 in our region was around the diseases, HIV, tuberculosis, hepatitis, prisons, etc. So consciously or unconsciously, we added stigma the discrimination towards people who use drugs. And then also the media added some narratives that like HIV epidemic is coming from us, like we are the driver, and almost never it was shown that we are not the reason, but the consequence of repressions, that the problem is related to repressive drug policies, because people cannot seek help, because doctors, they need to test their urine and send the results to police. Like, I mean, asking for any help is not possible. And 2 days ago, we had a meeting actually with the drug control bodies from Central Asia, and even talking about substitution treatment. Well, what we hear is that why do we need substitution treatment? Because the HIV epidemic is going down. So people are making this linkage. So we see that first we need to change our narrative and speak about changing attitude to people who use drugs. And all the organizations should be focusing on that, to say that the reason, the problem is about repressions against like people who use or possess drugs. And it is the key thing in order for the voices of people to be heard. As Sergey said, that we need like to have support when we talk about this. I liked like what Morgana said from Lithuania, when she said that I provided help to a person for 5 years. I provided treatment, and then police like arrests this person who received the services for 5 years and just ruins the life of this person, and also our efforts which we're implementing for 5 years. That is an important message, so that professionals from all areas would not be talking about HIV and hepatitis. Those are just part of the problem which we need to address with the Ministry of Health. But first of all, we need to say that drug control bodies, they need to be not about repressions, so that they would not ruin people's lives, because we have this a lot of drug trafficking in shadow, because they are doing the control, like they are controlling the market. But actually, access to drugs is really easy. And what is important is to change this narrative, not to have this association of people who use drugs and this negative connotation that we are the problem, because the problem is the consequence of repressions. And I'm happy to see that here we have the Global Fund and other regional problems, because raising funds for drug policy without focus on HIV is almost unrealistic. But when we have this focus on HIV, it just closes the possibility of quality and efficient advocacy. So, like we need to think how we change this public communication, and also we need to think how we will use this in practice. Thank you, Olga. It is really an important perspective, and actually change of perspective, that you were talking about, and how we can really help to implement the programs which would improve the environment and improve the health of people who use drugs. And the Global Fund is the biggest probably donor for harm reduction programs in the world. And the CRD team of the Global Fund, focusing on communities' rights and gender, tries to raise those issues and focus on them in the country proposals, which are usually the first steps in reforms in the countries. So Alexandrina, we really appreciate your personal role in promoting those issues in the region. So maybe you could like share like what can be done in the region to make sure that the issues of CRG and decriminalizations could sound stronger in the country proposals. Thank you. I will try to speak in Russian to share what I'm thinking. I'm sure that what Olga brought up is really important. It is really important to change our advocacy approach over the time so that we would understand our context and so that we would pragmatically understand what we can achieve in a particular country. Depending on where this country is on the spectrum of drug policy, on the spectrum of understanding of the role of law enforcement agencies. So let us use the opportunities that we have, like in terms of the country dialogue, when we work on new grant proposals for the Global Fund, and let us use the technical assistance that can be received from strategic initiatives on CRG, because this technical support actually can be aimed at communities coming together and discussing what pains we have, what bottlenecks and what opportunities we have for advocacy, and what priorities we have to be included in the country proposal. And it is better to start this process in advance, like before we have the allocation letters. Look at how the current grants are implemented, what results we have, what lessons we learned, and what gaps we have, because we have a lot of gaps in the region. And let us look at what is the level of those gaps, those problems, and what we can address when we advocate for legislative changes, and what we can address like irrespective of the laws that we have. If we work together with the drug control bodies, with law enforcers, what can we do together, not only with the health institutions, but with other partners as well, because often we speak to people who have opinions similar to ours. We talk to our partners, our allies, and very often we talk to communities and allies of communities, but we need to bring this dialogue to a different level, and we need to talk not only within our community, but use also other tools. So it is really important to see the results of this assessment that Tatiana, you shared, done by the Economist Intelligence Unit, and also the analysis of HRA, like what is the cost of criminalization. So if human rights arguments don't work, let us use the arguments of costs. Let us use all kinds of arguments so that together we can create the narrative which would make a real impact on the situation in the countries. And let us use our proposals to the Global Fund strategically, because in the strategy of the Global Fund, we have a focus on human rights, not only as a principle, but also as community-led monitoring, for example, community-led monitoring. This is something that Global Fund is ready to support. Also, community-based, community-led advocacy is an important intervention that we can support. And this monitoring and the reforms of legislation, sensitization of law enforcers, those are all interventions we are ready to support, which are part of our like documents and information which we give to our applicants when they work on their proposals. So let us together use this process of the country dialogue to bring up those issues systematically, so that we can prioritize like what we include in the grant proposals, so that we can depict the understanding of what we need to change so that our services reach people who need them, how we can ensure decriminalization, and in the process, how can we make sure that all the services are delivered and delivered efficiently. Thank you, Alexandrina. That was a very important, actually, like closing message in our discussion and in the team of the regional project and between our partners. We already have a lot. We have communities, we have the regional communities and the regional networks, which have been working on this issue for many years. And we have the Commission on the Drug Policy working at the regional level, and we have a lot of analytical tools, and this e-learning course could also be a real tool which would help us to build our agenda on decriminalization and justify it. And also we have the funding by the Global Fund to support those initiatives. So now the initiatives is on our side. So at the soccer field, Ukraine won yesterday, was the winner. So we hope that we also need to be the winners in this fight for the rights of people who use drugs, so that people do not suffer anymore, but they can integrate and can live a full life. Thank you all for this wonderful discussion. Thank you to IDPC and all our partners for initiating and adjusting this course. And I thank the Global Fund for the financial support. And I really hope that you will start using this e-course and share the link to the e-course with all people who might be interested. Thank you and goodbye.
Recording